No part of Central New York is safe from the spike in COVID cases, and that includes Cayuga County. We want to welcome back Cayuga County Health Director Kathleen Cuddy. Kathleen, thanks so much for joining us tonight.
Thanks for having me back.
All right, first, if you could bring us up to date on coronavirus infections in Cayuga County. We heard the Onondaga County Executive call it a brutal day here in Onondaga County. What are you seeing? A steady rise, and are you concerned?
We are absolutely concerned, and we are seeing our highest numbers ever as well. So that's not an inappropriate word to use. It is brutal, and it's affecting all of us.
And how many cases are you reporting today?
Today we had 32 new cases. Yesterday we had 42. That was our highest for any single day.
Wow.
It's continuous, and the number of contacts related to these positive cases is higher than it should be.
Yeah, everyone's painting a grim picture. Where are these cases coming from? Is it small gatherings? Who's to blame?
You don't like to pass the blame, but it's all of our own individual behaviors, isn't it? So it is people who are going to gatherings, it is dinners, it is going out to the restaurant or the bar, and it's hanging out with your friends. And no one is immune to this. And I think people are making inappropriate assumptions that their sniffly nose means they aren't positive. Well, they are. Stay home when you are sick. Stay home.
Yeah, even some of those minor symptoms that you might mistake for a cold could be a sign of coronavirus. I think people really need to hear that again.
They do. It's not always the dramatically high fever. It's not always the terrible congestion, although it can be. It can be very mild symptoms that we're seeing. They may develop into worse symptoms. You're contagious 48 hours prior to your onset of symptoms. You're contagious sometimes even when you're asymptomatic. So testing is important, and staying home when you do not feel well is extraordinarily important.
All right, and Kathleen, we've been hearing a lot about hospitalizations. How are they doing at Auburn Hospital? Are they running out of room?
I won't say they're running out of room, and I can't really speak for the hospital, but I did have a conversation earlier with one of their top staff, and they had 13 hospitalizations today with COVID diagnoses, and that's quite a high number for them.
Right, and do they transfer patients then to other hospitals when it becomes a situation where they're running out of room?
So at times, I think Auburn has received some patients from others, but depending on the complexity of situations, there have been patients that have had to be transferred to other regional hospitals.
Right, because it can stress the system.
Correct.
Yeah. We know that increased testing across the county is a priority there. Is there any more additional testing opportunities coming up that people should pay attention to?
There are, and people will see in Cayuga County tomorrow the opportunity to sign up for some additional testing. There will be a drive-through clinic for symptomatic people on Saturday. There will also be a clinic for asymptomatic people at a different site on Saturday. And we hope to continue to offer some of these as our human resources and testing resources remain available. So we hope to get into a little bit more regular habit. Additionally, our hospital will have asymptomatic testing on Wednesday.
That's good. And contact tracing, let's talk about that. You know, especially after the Thanksgiving holiday, how effective has that been? How difficult has it been?
Difficult is the word.
Yeah.
We, like so many counties around us and around New York State and our country, have just exploded with the number of contacts. We are now using virtual contact tracers through the virtual call center, which is not something we previously did. But the numbers became so unwieldy for us to be able to handle on our own that we've had to go remote and virtual in that capacity.
Oh, wow. That speaks volumes of what you're dealing with. Let's talk about the vaccine. You know, we're all hoping for that vaccine to come. Have you gotten any word when your county might be receiving that?
We don't have any official word, only what we're hearing through the governor's office also in their press conferences at the moment. But we are certainly preparing for the opportunity to offer vaccine to our residents. There's the priority listings, which we agree with. And we are planning to have a meeting next week to talk about how many different entities will be offering the vaccine around our community.
All right, we'll be keeping in touch with you on that. And while I still got you, let's drive the point home. we do still have control over what happens, right? What would you like to say to people who are just tired of following the restrictions and going ahead and having their group settings?
Stay home, stay home, stay home. We are in control of our own individual actions, and what we do does affect others, and it affects our community. We're all in this together. Please limit your interactions with people significantly.
Kathleen Cuddy, thank you for joining us and being such a good messenger.
Thank you.